When you see someone laying on the floor, the first thing you need to do is check the scene. If the scene is unsafe, you need to call 911. If the scene is safe, then you need to continue on with your evaluation. First, you're going to check with a verbal response, so you're going to call their name, ask them if they're okay.
Adriana! Adriana!
If they don't respond, you're going to start with a physical response. So you're going to take both hands and gently shake their shoulders, assume that they're paralyzed. And then once you're done with that, you need to assume that they're unconscious, so you need to call 911 immediately. If you're alone, you should do it yourself. If you're not alone, you need to have someone else call 911.
Next, you're going to assess the CABs. You're going to check for circulation with a carotid pulse by using your 2 distal fingers and placing it on the side of their neck closest to you. Next, you're going to assess their airway by using the head tilt chin lift method. And then you're going to assess breathing by placing your ear over their mouth and listening for breathing while looking at their chest for movement. If their pulse is present and they are breathing, luckily you can stop. If their pulse is present but they aren't breathing, you're going to start with rescue breaths. You're going to do it up to 10 times every 6 seconds or within a minute. And if it doesn't go in and you don't see their chest rise, you're going to re-tilt their head and lift their chin.
1, 2, 3, 4, 5, 6. 1, 2, 3, 4, 5.
Next, you're going to assess the CABs.
If the person isn't breathing and they don't have a pulse, then you're going to begin compressions. Your goal is to do 100 compressions per minute, so that the amount of times that you do compressions has to be consistent and fast. So every 30 compressions, you're going to give the person 2 breaths and then continue with your compressions.
8, 9, 10, 11, 12, 13, 14, 15, 16.
If you see someone with their hands around their neck, you're going to assume that they're choking. If they're silent, that means their airway is blocked. If their airway is not silent, if they're making noises, that means that you want to encourage them to cough to get their airway clear. First, you're going to ask them, are you choking? If they say yes, with a nod, that means you're going to ask them,
Are you choking? I know CPR, can I help you?
So for the back blows, you're going to stand on the side of their body closest to their arm and just placing your non-dominant arm in front of their bodies, and so like in case they fall forward, you can catch them. And then you're going to place your dominant hand and take the heel of your hand and hit between their scapula kind of violently so that it's effective. But you're going to do that 5 times until they hopefully cough up whatever they're choking on.
2, 3, 4, 5.
for the abdominal thrust, you're going to take the thumb of your dominant hand and you're going to place it above their belly button in between your ribs, and you're going to take your non-dominant hand and place it over it, and you're going to make the up and in motion 5 times until the food is out or they become unconscious. And once they're unconscious, you're going to call 911. But while you're doing this, you need to put your feet in an L stance. So you're going to put your dominant foot in between their legs, and you're going to have your non-dominant leg faced out, so just in case they can slide down your leg if they become unconscious. For unconscious choking, you're going to do the same exact steps for CPR, except there's one difference. After you do the 30 compressions, you're going to do the head tilt chin lift, and you're going to look to see if there's food in their throat. If there is food, you're going to do a pinky sweep, so you're going to take your pinky and sweep it from further away, and you're going to bring it closer to you to get the food out. If you don't see food, make sure not to blow in their mouth because it could block their airway.